and welcome to the video presentation on cardiovascular emergencies by registryready.com. In this segment, we're going to talk about acute coronary syndrome. Now, acute coronary syndrome is seen whenever there is decreased blood supply to the heart, which is known as ischemia. So, ischemia is when there is decreased blood supply to the cardiac muscle cell. This ischemia can generate a type of chest pain which is known as angina. It is typical of cardiac origin, in which the patient will describe the pain located retrosternum, describe it as a dull aching pain or a feeling of heaviness in the chest. It will be severe, progressive, and they can even describe radiating pain to the shoulder, arm, back or jaw. And the reason for this being is that the nerves that supply or the nerves that sense the pain from the heart have common origin with the nerves that are sensing pain from the arm, jaw and back, which is why you can have referred pain to the shoulders, to the back and to the jaw. Now, ischemia or decreased blood supply happens because of narrowing of the blood vessel, and this narrowing is brought about by atherosclerotic plaque. So this plaque is present in all of our vessels in young age group through to people who are old as well. But not all of us experience angina or angina-like symptoms. That's because our heart is able to meet up with the increasing demands. But when that does not happen and there is significant narrowing when the demand exceeds supply, that's when you get symptoms of angina. Let's say a small portion of this atherosclerotic plaque breaks free and travels and goes and gets occluded in a smaller branch of the vessel. When that happens, when there's complete occlusion, the downward portion or the downward part of the artery, whichever tissue it supplies, gets zero blood supply. In that, the cells will eventually die. And this cell death brought about by a thrombus or an embolus is known as myocardial infarction. And this cell death can be seen 15 to 20 minutes after complete occlusion has taken place. Now, what are the other signs and symptoms of myocardial infarction? One is that they would describe typical chest pain like angina. They can have associated symptoms like nausea, vomiting, feeling of indigestion, dizziness, fatigue, palpitations. So it is important for you to ask the pertinent associated symptoms whether they are present in a patient or not, because the patient is not going to be able to correlate nausea and vomiting with an ongoing chest pain, that this could probably be a myocardial infarction or a heart attack for the patient. Now, your main aim pre-hospital is pain relief. You can't do anything to break the clot or to restore blood supply. But what you could do is give pain relief to the patient. For that, you can use a drug called nitroglycerin. Nitroglycerin is a vasodilator, in that it dilates the coronary artery and the other large vessels. If it dilates the coronary artery, it's going to open up the narrowing, it's going to increase the blood flow, and which is going to give pain relief. But when it dilates other large vessels, it has a tendency to drop the venous return. This drop in venous return has a desired and an undesired effect. Desired effect being that if there's decreased venous return to the heart, that means decreased blood flow coming back to the heart, means the heart has to work less than what it was. So its demand starts to go down. When its demand starts to go down, whatever supply was there can meet up with the reduced demand. So decreased workload is the desired effect, but sometimes the decreased venous return decreases so much that the blood pressure falls completely, which is the undesired effect or the side effect of the drug. Now, just a drop in blood pressure, you should be prepared for a drop in blood pressure, but say it drops less than 90 systolic blood pressure. What's going to happen is that the body is going to compensate by increasing the heart rate, known as reflex tachycardia. And when there's increased heart rate, it's not going to reduce the workload, but it's going to increase the workload. So nitroglycerin acts as a double-edged sword. So you have to be prepared for a drop in blood pressure whenever you administer nitroglycerin to the patient. As an EMT, you can only assist in giving nitroglycerin. That means the patient should have his own prescription of nitroglycerin, and you can help him take that medication. But as an AEMT, you could administer nitroglycerin to the patient. Always make sure that there are no contraindications. Contraindication, the first one being that patient should have a permissible systolic blood pressure. Should be at least over 100 systolic blood pressure. Second should be that the patient should not have consumed any other vasodilators in the past 24 to 36 hours. Common group being the group of drugs which are used to treat erectile dysfunction. So always inquire about the use of these drugs in the past 24 to 36 hours, and if that has been consumed, then please do not administer nitroglycerin. The second drug that you could use pre-hospital, which can cause minimal pain relief, but at least it will prevent further damage being done, and that drug is aspirin. Aspirin has two good indications that we need. One is an antiplatelet effect, and the second one is anti-inflammatory. Reduced blood supply to the cells will cause the cells to get injured and damaged, which means that there's going to be localized inflammation around the tissue. Whenever that happens, the body is going to activate its immune system. By activating its immune system, it's going to worsen the pain and the inflammation that's happening around the injury. It's also going to activate the platelets, so that the platelets start to get aggregated. In that, it will just worsen the clot which is already present. So giving aspirin, you can get an antiplatelet effect and an anti-inflammatory effect. And the dose of aspirin that you will use is 324 milligrams. That is a single adult tablet. Patient should be chewing that tablet. And the second one, if you don't have the adult dose, you could give 4 of the 81 milligrams. So 4 of the baby aspirins or the child aspirin to this patient. Don't forget to do your remaining assessment. Don't forget to check oxygen saturation. If it's lower than 94, give high flow oxygen. Be ready for any kind of side effects when you administer nitroglycerin. If the blood pressure falls, make sure that the patient is laying supine, raise the legs, keep the patient warm, and always transfer the patient to a cardiac center.